I have been a nurse practitioner for over 8 years, and today I'm going to tell you what I wish someone had told me before I became a nurse practitioner, and it would have saved me so much headache, heartache, and prevent me from thinking I made a mistake in my life. What that means for you is that if you're a nurse practitioner or a medical provider, you don't have to dread your alarm clock every morning. And you don't have to look at your patient list, your patient schedule for the day and feel overwhelmed, feel inadequate. You don't have to wake up every morning and wonder, did I make the right career decision? Did I make the right decision for my life and my future? Because I felt all those things before. For those of you who are new here, hi, my name is Nicole. I am a rheumatology nurse practitioner, and I help nurse practitioners and other medical providers find happiness in healthcare and connect with their patients in 60 seconds or less. The first thing I wish someone told me before I became a nurse practitioner is that the learning never stops. The learning never stops. You know, when we go to school and we study to pass exams, we study to get to our boards and pass that with flying colors so we can get our license and our certification. And we are sort of fed that mindset that the studying will stop at the end of that. Like that's the end goal, is to pass the exam. But the truth is, when you work in healthcare and when you're a nurse practitioner or a medical provider, the learning never stops. You are signing up to be a lifelong learner for your career. The biggest exam you'll ever have truly is having a challenging patient case with these symptoms that don't make sense, that isn't textbook, and being a detective and trying to figure out and piece together what is going on and what disease or what syndrome they have. And that's the biggest exam you'll ever have. You know, it's sort of scary once you graduate school and training. You no longer have your preceptors to depend on. You know, as a nurse practitioner, you can still ask questions to your supervising physicians. But there are so many days when I'm the only medical provider in the clinic that day, and I have to figure things out on my own. I have to look at the guidelines, I have to do research, I have to look at my old textbooks, I have to look at the databases and the studies. And so I'm kind of challenged on a regular basis. And, you know, as my first few years as a new grad nurse practitioner, I spent countless nights late at work, writing my notes, researching these diseases, and figuring out what these patients have. And I was going over new guidelines, my notes, making sure I was typing everything correctly, looking at the history and the patient's chart. And I would be calling patients at night past dinner time to let them know I need to correct a mistake, I need to send them a prescription, I need to correct the dose, the frequency, all these things. You know, no one told me that I would still feel like I'm still in school the first few years as a nurse practitioner practicing. And you know, the challenge, it sounds so scary, it feels so scary, but that challenge is actually really good for you. It actually prepares you to be a better nurse practitioner. And forcing yourself to constantly learn teaches you. It teaches you how to be adaptable, how to be flexible, and to learn new things and to constantly stay up to date. You know, recently I've went to a drug dinner presentation on a brand new medication for an autoimmune disease that we treat here out in rheumatology. And there are so many medications in my specialty that did not exist when I was in nurse practitioner school. Like, it's wild. My NP training from school is actually stale and outdated. I have to stay updated on what's the new medications, the new studies, the new algorithms, all these things. I have to stay updated on that. You know, Albert Einstein once said, once you stop learning, you start dying. It's a little bit morbid, but it's true. It's sort of uncomfortable to feel like you don't know everything, right? And that's totally normal because in healthcare, we don't know everything. We really don't. I mean, I treat autoimmune diseases and we don't know everything. That's why we don't have cures for these things. And I think that's why I really struggled in my first few years out as a nurse practitioner. I thought that school was supposed to prepare me for everything, but school barely got me through the basics. Barely did. And I think the most important thing that school taught me was to always feel uncomfortable and to normalize always walking in and feeling a little uncomfortable, a little on edge. You know, in school, I would always feel a little anxious walking into the classroom because I knew that the teacher may call on me, ask me a question, test my knowledge. Did I read the chapter? Did I really absorb and understand the material? And that feeling doesn't always go away, even when you're practicing, even when you're working with patients and you have autonomy as a nurse practitioner. That feeling, that uncomfortableness of not knowing everything, it doesn't really go away. And so I want to encourage you to normalize feeling uncomfortable. I want to encourage you always be asking questions. Even my supervising physicians ask each other questions because they know they don't know everything. And so feeling uncomfortable and being open to constantly learning is my new norm, is my new normalcy, and is the first thing I wish someone told me. The next thing I wish someone told me before I became a nurse practitioner is that nurse practitioners are pioneers. Nurse practitioners are pioneers. Nurse practitioners have been around since 1965. Did you know that? 1965 is when the first NP role was created. It was created by a nurse named Loretta Ford and Dr. Henry Silver. So it was a collaboration between a nurse and a doctor at the University of Colorado out of a need to increase patient access to pediatric care. And so that's 59 years ago. If you're watching this video today in 2024, that is 59 years ago the NP rule was created. Let me ask you another question. How long have doctors been around? Physicians? Like forever. Okay, that's probably not the most accurate answer. I'm going to give you probably the closest accurate estimation. The Hippocratic Oath that all physicians practice, and they say at their white coat ceremony, every physician knows this, the Hippocratic Oath of do no harm was originally created around 500 BC. 500 BC. And so if you want to do the math, that was 2,520 years ago. 2,520 years ago. So nurse practitioners have been around for 59 years and physicians have been around for 2,520 years. So if we do 59, I'm going to do a little math right now. 59 over 2,520, that's 0.02 or 2%. Nurse practitioners have been around for 2% of the time that physicians have been around. And that is why nurse practitioners are pioneers. And that's why I say that. The dictionary definition of a pioneer is a person or a group that originates or helps to open up a new line of thought or activity or a new method or technical development. And so nurse practitioners is a new idea in healthcare. I mean, nurse practitioners don't even exist outside the US. The majority of the world, it's still just physicians. And so as a pioneer, I want to remind you, as a pioneer, it is normal to question yourself because you're doing something new. You're doing something that goes against the grain, that hasn't been done for the majority of time. And so as a pioneer, it is normal to question yourself. But also, as a pioneer, it is normal for others to question you. I'm going to say that again. As a pioneer, it is normal to question yourself. And as a pioneer, it is also normal for others to question you. You know, I've been practicing for over 8 years as a nurse practitioner. And to this day, I still get patients who would rather see the physician than me. And that's okay. Change is hard to adapt for anyone. And if you're listening to the podcast, I highly encourage you to watch this YouTube video. So in any business or industry, every business industry follows the principle or the law of diffusion of innovation. Okay, I'm going to use the whiteboard here to explain this bell curve because this is actually really important. So the law of diffusion of innovation tells us about any industry, any business, if it will succeed. So it looks like a bell curve. And the first 2.5%, you have your innovators. The next 13.5%, you have your early adapters. And then you have the middle, which is the majority. You have your early majority and your late majority, and they're 34% each. And And then you have your laggards, which is the last 16%. So the law of diffusion of innovation explains that if you want mass market success or mass market acceptance of an idea, you cannot have it until you achieve this tipping point right here between 15 to 18% of market penetration. Then the system tips. So when you can achieve the 34% early majority and the 34% late majority, you have great market share in your industry, in your business. But when you're just in the beginning, the early adopters, people are not going to buy something. They're not going to buy into an idea or buy a product until majority of other people have done it. And so, most businesses, they really struggle when they're in this beginning phase of the innovators and the early adopters because they don't have the majority market share. We're at 2% nurse practitioners. We are at 2% of the timeline of how long doctors have been around. So we are still at the innovation stage. We are still so early. So this is why I say nurse practitioners are pioneers. We are just getting started. We are just getting started. We are just paving the way for the next generation of nurse practitioners. And so you are making a huge change in the world. And so I wish someone had told me that as a nurse practitioner, you are a pioneer. It is normal to question yourself, and it's normal for others to question you, and normalize that. Now, the next thing that I wish someone told me before I became a nurse practitioner is that my greatest competition is Dr. Google. It's the internet. No one warned me, and I wish someone warned me, that I would sacrifice years of my life in order to make people better, to make people healthier, and yet people would still question me. People would still question my expertise. My biggest competitor isn't my supervising physician, which we just talked about, that some patients prefer to see the doctor versus me. But the truth is, your biggest competitor is the internet, is Dr. Google. The internet became public in 1993. That is 31 years ago, as of this video uploaded in 2024. And so the internet has completely changed the world. It's completely changed how people get their information. It's changed what kind of information people have access to. You can go on the internet and research just about anything now. And the problem is that sometimes the information out there on the internet isn't the most accurate. And that means now is that you are presented with patients who come to see you, armed with all this information they found from Joe Schmo's website, or maybe a Facebook group on someone saying, I had a bad experience with this medication and I do not recommend it for anyone. When in reality, that was just one isolated incident. And so as our world evolves and changes with the internet, and people have now evolved into how they get information, how they access information, you too must evolve in how you communicate with your patients in today's modern era of healthcare. How you interact with your patients, how you speak with them, how you interact and communicate with them, that must all change and evolve and grow. I want to give you a little example that's completely not medically related. So if you've ever heard of the peppered moth, it's an insect that grows in England. And originally they were very light colored because these pepper moths would camouflage against the light bark trees in England to hide from predators. But during the 19th century, with the change of the Industrial Revolution, and soot would cover and change the environment. And now the trees are soot colored, they're dark colored. And so the moths have evolved. So now their wings are dark colored. So they camouflage better against the dark soot colored trees against their predators. So even in nature, it's a principle. Everywhere in nature you see it, things evolve, things must change. And so people often think that they already know how to communicate because, I've learned how to talk since I was 1 year old. But talking and communicating in a way that impacts people, two very different things. Communicating in a way that impacts people, that helps people make healthy decisions for their life, to help build the life they want and live a healthier, more meaningful life. And having patients tell you, you're my favorite doctor. You're my favorite nurse practitioner. I only want to see you. Those things I've had patients say to me, all those things. That really fills you with a sense of purpose. That fills you with a sense of fulfillment that, yes, I'm doing what I should be doing. I actually feel like I'm doing what I have always wanted to do. I'm not questioning my career decision. I am truly finding happiness in healthcare. And if this sounds something like you'd want to learn, then you need to check out the next round of my masterclass, How to Connect with Your Patient in 60 Seconds or Less. It's the masterclass that I teach you the framework of how to connect with your patient instantly. And so the link is down below in the show notes or the description box. Benjamin Franklin once said, "For the best return on your money, pour your purse into your head." Communication skills is the most important skill set I truly believe any person can have. Because if you can communicate what's in your brain, your ideas, and make them resonate with people and impact people, there is no ceiling for you. The opportunities are endless. So, those are the things that I wish someone told me before I became a nurse practitioner. But what about you? What do you think? If you're a nurse practitioner, then type below. Let me know, what do you wish someone told you before you became a nurse practitioner? Otherwise, I hope this episode was really helpful, and I'll see you all next time. Bye.